Do you feel you need to avoid certain points on the body during pregnancy and fear that it might stimulate birth? If so, please listen in to today's episode as I speak with Suzanne Yates, a traditional Chinese medicine provider and Shiatzu practitioner, as she explains how she works with the body during pregnancy. Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started. Hello, everybody. Welcome to this episode. And today I'm excited to share with you Suzanne Yates. And I'm going to have Suzanne introduce herself and tell us what we're going to be talking about today. Suzanne, welcome to the podcast. Thanks for being here.
Hi, thanks for inviting me. Yes, as you can hear from my accent, I'm English. I actually live in France now. But my main thing that I want to share with you today is my knowledge of traditional Chinese medicine. Now, I started studying that in the 1980s. So it's like it's actually 40 years now. And I did a 4-year training in Shiatzu, which is acupressure, form of, acupressure, body work. And I later also added in massage because I wanted to also work directly with the body. And over the years, I started specializing when inspired by my own pregnancy. I wanted to explore more how certain areas, often people are a bit wary of working with certain areas of the body. And I became pregnant when I was assisting my shiatsu teacher, and we had lots of students asking questions about, oh, is it safe to do this or that in pregnancy? And what are these forbidden points? Some people talk about them as forbidden acupressure points. And so I started actually first by experimenting a bit on me, because didn't really feel confident to experiment on my clients. And I was a fairly new practitioner then. I'd only been actually working with shiatsu for 2 or 3 years. So I didn't really have the confidence or the experience to really feel I could start experimenting with my clients. So I started experimenting with me, and actually my fellow assistant on the training was also pregnant. So it was really great because we were able to try things out on each other first and to see that it changed from day to day. And really that what we had to do was trust what we were feeling, because we've been trained to work with the body. What are we actually feeling? And is this point today, now, a good point to use or not? And from that, bit by bit, I started having gradually more confidence in working with my clients, because then through my own pregnancy led me to study a lot more about pregnancy as a whole, both from a traditional Chinese medicine point of view, but also I felt I needed to understand more the anatomy, physiological changes in pregnancy. Part of that was studying with Elizabeth Noble in America, in Boston.
So
Yeah.
for those physical therapists listening in, I'm not sure if you're younger, you may not remember Elizabeth Noble is one of the pioneers of bringing physical therapy to the pregnancy postpartum time frame, at least pregnancy time frame. So, what was that like studying with Elizabeth Noble?
It was amazing. It was really intense. It was like about a week and really intense. And the level of anatomy and physiology, I could just about keep up because I was seeing it more from a TCM point of view. But the most amazing thing I found was her confidence in a woman's body, her confidence in the power, and that we shouldn't be treating women as though, they're really weak and feeble. I mean, this was 30 nearly 35 years ago, but even so, um, she felt really, that was what I found most inspiring, that it was really about supporting women to be strong and in tune with their bodies, and to really take her book that inspired me to study with her was Essential Exercises for the Childbearing Year. So she really took it into postnatal, which was really helpful for me as well, to not just stop with pregnancy and birth, but how can we continue to support that work in the postnatal period. And so having a lot more confidence in what was physiologically going on in the body took my level of trying to understand the points to another level so that I could understand theoretically why might they be considered dangerous. But in fact, they're often called forbidden points. But now over the years, I do have obviously a lot more clinical experience of working with them. And I do find, sometimes I want to work them, even in the first trimester. Sometimes it feels like maybe it's a bit too much. But equally, right at the end of pregnancy, because the two main periods that in the whole maternity phase that practitioners are a bit wary about working these so-called forbidden points are in the first trimester. I mean, 35 years ago, there was even a lot of people saying, should we even work at all in the first trimester? Whereas actually, I turn that around these days and say, well, that's the foundation of everything for the baby, certainly for the mother also. And it's really important to work in the first trimester.
Okay, so let me interrupt you here.
Yeah.
Sorry, Suzanne.
I
I
get carried away sometimes, yeah.
no, no, no. I just want us to clarify because I think this is so important for anybody who works with pregnant people to understand as a body worker. Are there really forbidden points? Are there points on the body that we should totally avoid in the body at any point during a pregnancy? Is there something that we could do as body workers that could cause harm by working these points?
I really don't believe so. But first, I have to say one provision. The most important point for any body worker, and hopefully that's what we're all trained to do, is to listen to the body because each
Yeah.
person's body is very different and they have a very different experience. So if you're working with that and really listening to the body, and if you're not sure, then also I often, and we talk about this in the longer interview that I'm doing for you, ask the mother, how does she feel this point? Is if we're not completely sure, oh, this is a good point, ask the mother. Because it can be true if a woman is having a more complicated pregnancy. I mean, I'm thinking especially of women with, I've worked with women who've been on bed rest, who've had really weak cervixes or wombs that are dilating too much, cervixes that
Incompetent.
are dilating or wombs that
Yeah.
having a lot of contractions. I mean, we know the womb is contracting all the way through pregnancy anyway, but that they have over too many contractions. And then I have to be a bit more careful. And then sometimes in those more extreme situations, I find that some of these points are on powerful areas and even touching lightly may feel too much. So I'm not saying to people, go ahead and just use these points like with anybody and don't have any,
Concern.
don't feel that because I'm saying yes, they're not going to cause harm. You still have to listen to the body. You still have to feel, try and really tune into the energy of the point. And if you're not quite sure, check with the mother. But with that proviso, I can say it's actually fairly unusual that I don't feel I want to work the points a little bit. Even some of the points, like some of the points are on the sacrum, aren't they? Some people are quite wary of working the whole sacral area even in the first trimester, because they're worried about ligament, connections with the ligaments, maybe interfering with, putting things out of balance because levels of relaxin are high in the first trimester. They're worried that it might interfere with the womb somehow. But I've had clients that I've worked with in their third trimester and they've loved the sacral work. So in their next pregnancies, they're like, oh, can you do some of this sacral work in the first trimester? And when the first client that asked me that, I'm like, well, we're really not meant to do too much on the sacrum in the first trimester. But she was like, oh, please, it helped me so much. And I said, okay, if you really talk me through it, this is the first time I've done it in the first trimester, guide me. And actually, I was surprised how, obviously, I'm not going as deeply as in the third trimester, but I was surprised how deep with her I could go. And it did feel like that's what her body needed because it's not like that's the thing. Acupuncture points, acupressure points, they have different effects on different people. So it's not like we press a point and we know exactly what's going to happen. It's related to the whole complex system of meridians. So, I mean, even if you don't know the meridian, even if you know the meridians, you still don't know exactly how that person or that woman, that baby is going to respond on that day. So particularly as body workers, we have to really feel that. So yeah, in the first trimester, the sacrum, I do sometimes work it. I don't work it really vigorously. I've never worked with my elbows, I don't think, which I do a lot in the third trimester. But I suppose the other message I want to communicate to people is don't be afraid. Because I think also if we're fearful in our work, we're then transmitting fear, aren't
Yeah.
we?
Yeah.
Whereas we don't really want to be working with fit. So I actually also, that's the other proviso. I say to my students, if you're afraid and you're touching this point and you're not comfortable, you're not confident, you're afraid, then don't do it. Because, if something did happen, then you'd just be blaming yourself and thinking, even though that's not how the body works. When we're touching a point, we're connecting with the whole body systems and we're helping the body to do what the body needs to do. So, I mean, actually, and it can be a hard thing for people to accept. If there is a miscarriage, it's because that's what the body needed to do. It's not like we're making somebody miscarry. It's that in our work of balancing the body, we may have supported a miscarriage, but we're not creating it. And that's the difference. So I think if that's sometimes I say that for people just generally working in the first trimester, as we know, the rate of miscarriage is actually quite high. So if we work with a lot of women in the first trimester, some of them will miscarry. So that's why I think, especially in the first trimester, we need to be really clear. Is this the right thing? Do I, as a practitioner, feel comfortable working with this point? But I can just say from my experience, these points are powerful, and we have a list of them. I've made a diagram for you of these main points, and they're powerful points. But I like to think of them as transformative points or powerful points. So when we work with them, we do want to honor them and respect their power and just use them if we feel that's what we're called to do, but to not be afraid of their power and to not work transmitting fear, but tune in and think, oh, how is this going to transform this woman's sense of
So
herself?
two questions are coming up for me, Suzanne. One is if a woman does miscarry after working with us, how do you handle that? Because I think a lot of us body workers, practitioners are, don't want to be blamed for
Mm.
the
Yeah,
miscarriage,
yeah.
and have that fear of, oh, did I create that? So
Yeah, yeah.
what would you want people to know with that?
I want them to know that they can't create it. And, midwives, obstetricians, I often have midwives or not so much obstetricians on my courses because I teach pregnancy massage and pregnancy shiatsu. And I say to them, what's your answer to that? And they're like, there's no way that touch, is it is going to cause a miscarriage. Even if you think about it, women can be in a violent relationship and they suffer abdominal trauma, and sometimes that can cause a miscarriage, clearly, although in a car accident, another example. But sometimes the baby survives. It's actually quite remarkable if the baby is strong, if the mother's body is strong, there's actually very little you can do to end a pregnancy.
Right.
You have to, what you're doing is not, actually causing some quite traumatic event to happen, which is not what we're doing in body work. So I think that that's something to know, that if a miscarriage happens, we can't have caused it.
Okay.
But I think it's also because of that. If a woman comes to see me or is wanting to make an appointment and she's in her first trimester and she's sounding very anxious and she say, can you reassure me that body work, is okay? And I'll say, look, if you're just going to be lying there feeling really anxious, there's no point in you coming.
Yeah.
I only want to work with you if you actually feel comfortable. If you're just feeling anxious, like with the practitioner, if they're feeling anxious, then I say, don't work in the first trimester with somebody. I think I was lucky in that in my early years, it was more the other way around. I had quite a lot of women coming who had had previous miscarriages and they came to see me to try and,
Support it
not
more.
have a miscarriage. And
Yeah.
they didn't. But, I don't know whether it was my work or not, or just because they were
Yeah,
more relaxed, or whether it would have happened anyway that they might
right.
have carried on. Do you know what I mean? I think we
Yeah,
also have to recognize our limitations. All we can do is support the body to be to do what it can do in the best possible way.
right, right. My other question for you is, can you tell us how do you listen to the body? What does that really mean for our listeners
Ah.
listening in? Like how, what would you say?
I think it's individual for different body workers because some people can actually see the
Hmm.
energy and they see different colors. I don't so much see
I don't
colors.
either.
I get feelings
Yeah.
sometimes.
I
Oh
do.
yeah, I'm invited in. Oh yes, this feels good.
Yeah.
I work a lot through the quality of touch. If the body's kind of, and we learn that a lot in Shiatsu, is the body kind of drawing us in? Is it saying yes? You know, if I don't
Yes.
know if some of people that are listening may work with babies and baby massage, and babies are very easy to work with because they'll move their body. But again, there's more subtle variations in like feeling the tone of a muscle, but feeling the energy and yeah, is this muscle wanting to be worked on and or not, or am I being pushed away? So I go a lot with that. Even more obvious physical things if I pick up a limb and there's a lot of tension. And then I just try different things as well, like
Mm.
a bit of mobilization, lighter pressure, more enveloping pressure. You know, there's all different tech sort of massage and shiatsu type of techniques. And just see, you know, is the body letting me in? Am I feeling, and especially with shiatsu, we start to feel energy moving, but what does that really mean? Heat
Right.
sometimes, you know, heat, I always think heat is quite a good sign. If the area is warming up, that is showing that, you know, obviously blood is a form of energy. Everything's expressions of energy. So is there some like response where there's a warming or I feel a tingling or I feel some more internal movement? Obviously, you feel change in the nature of the tissue. If it's very contracted, then hopefully you're feeling it's gradually releasing. If it feels quite flaccid, you sometimes that's what I'm looking more for. Obviously, in just one body work session, if the abdominal muscles are very lax, for example, you're not going to retone them in one session. But I feel there's something, you know, warming, something kind of meeting me, something like that. Is that enough
I love
information?
it. Yeah. I just,
Yeah,
you're right. Energy is a little elusive to palpate and to work with for some people, and
yeah,
other people are like, oh, I can feel it, and I try to teach this as well. So I really appreciate your take on what that all is for you, and
yeah.
I just feel it is so incredibly important that we all figure out ways to listen to the body and
Mm,
to figure out what, like I keep teaching, go beyond your touch, go
yeah.
beyond the tone and tension in the muscles, because
Mm.
it's, are you getting invited in, you getting pushed away? Are,
Oh yeah, you use those things.
I
Yeah,
do,
that's
I
yeah,
do. Yeah.
yeah, yeah.
And so, it is a little bit of a nuance in order to be able to teach it. So I just appreciated your take on that. So thank you. That's
But
awesome.
also, I would say each person's perception of the body is slightly different. So don't
Yes.
try and emulate somebody else. If you see energy, great. If you don't see energy, don't think, oh, I've got to be able to see energy. You know,
Oh,
actually value what really question yourself, how is it that I can tell if I'm invited in or not? And really, it's a process of self-reflection, I think. To encourage all my students, I encourage them to reflect. They say, how do you know? And I can say, well, I can tell you how I know, but you need to feel. And you know when you're feeling, don't you? You
yeah.
get a sense of. There's also I actually use my own body because if I'm feeling tense, I think, oh, something's going on here. And if
Yes.
I'm feeling relaxed and in the flow and I can feel, yeah, there's a real flow in my own body. So I actually use that. I notice sometimes when something's finding it hard to release, sometimes I get a tickle in my throat or I want to cough. And so I think also use your own body because as a body worker, we are actually connecting with the physical body and the energetic body, and we're part of that field. So listen to also what's going on in your body.
I
That's
love
another.
that. I
Yeah,
love that. Yeah, I say that we are the residents for our clients, just like
yeah,
a mom is for the baby, that, that's where we have to do our own work and be able to show up powerfully in our own
yeah,
beingness
yeah.
and be connected to that enough to be able to sense those changes and nuances within our own bodies, to be able
Yeah.
to sense that in someone else as well.
Yeah. To be able to be still and actually almost to see, again, aura sounds all a bit, but actually the space around the body, working with pregnancy and birth, you can see that quite tangibly as the memory of the amniotic sac, and that there is this kind of memory around our sense of protection. And so I think it's also how we first approach a client, how we hold the space, but actually being calm and the actual physical space in which we work is quite important. Can we be calm? Because if we can't be calm in that space, how do we expect our clients to be calm in
Or
that
to
space?
become calm. Yes,
Yeah,
right?
or to become calm,
Yeah.
exactly. So
Yeah.
all of that. And then
Okay.
I think all of that then helps us with these points. Do you want me to say a bit about the areas of the body? I mean, I mentioned one of the areas,
Yeah,
but
I was just going to ask about the points here just a little bit, because I do want to mention that Suzanne is a part of the Birth Healing Summit this year, and her interview was incredible. And we talked a lot about the extraordinary vessels, which are points, certain points on the body. And then you talked a bit about the meridians, and you also shared with us three different techniques that we can do with our clients. And I have to say, personally, myself, you really help to open up to me a whole nother awareness of ways that I can support my pregnant clients beyond what I know as a physical therapist. So I am super grateful for this knowledge, Suzanne, that you did share on that summit interview. And I encourage everybody to please join us this year in April and learn more from Suzanne. And you'll get this handout that I have here. We'll see if we show it. If you're listening to this one, you can check it on my YouTube channel to actually see it, or join us for the summit and you'll get it actually as a gift. So go ahead, Suzanne, and dive into some of the other areas. You had talked about the sacrum. What else should we know about?
yeah, the sacrum. Well, often the points are around the ankles that people are wary about. And around the ankles, I think it's really fascinating, but mostly more on the inside of the ankle. And they are acupressure points, which are on the diagram. So there's the main one is spleen 6, which is if you put your little finger on the tip of your inside ankle bone and then along your index finger, so hooking under the tibia. It's often quite a sensitive point, particularly in women, whether you're pregnant or not. So it's usually quite easy to find. And then it's called spleen 6. It's also the meeting of the three yin, and it's a point, as you said, on one of the extraordinary vessels. And it's considered one of the most important points for women for connecting with the womb. And why it's been transformed into this fear of connecting with the womb is a bit weird in a way, because it helps to regulate the womb. So, yes, it can be sensitive. So, when we initially touch it, so I think, again, a good way is feel it on yourself and get to know and sense how it changes, especially if you're in your menstrual years, how it changes through your menstrual cycle and how much pressure feels comfortable, because that's one of the big things. If you hold it and just put your thumb without much pressure, it probably doesn't do very much. And then you need to tune into how much pressure to give. And then you'll know if you're invited in, especially when you're, because they're energy points. It's like, is the energy drawing you in or is it pushing you away? And to respect that. And so you play around with how much pressure you want to give and also how long to stay. And so sometimes people at the end of pregnancy say, use this point every day for 3 minutes. And I don't agree with that either, because that might be, how do we know if that's
Yeah.
overstimulating or understimulating? How do we know when the baby's going to be born anyway? So it's a point. Sometimes people say, "Oh yeah, from 40 weeks we can start stimulating this," and I'm thinking, well, you could have done from 37 week or even in the first trimester if you're really tuned into this point. Spleen 6, and it's on an extraordinary vessel, so it's very much linked with our womb, but also embryologically, and this is what I love about Chinese medicine, when you study how our body develops, our feet actually do grow, our feet form first before our leg. So you could say our feet are growing out of
Mm.
our reproductive
Yeah.
organ. They're
Yeah.
very closely connected. So the points, yes, they do closely connect to the womb, but it's not going to cause something. Why do people think it's going to do something unhelpful for the woman rather than just support her connection with the womb? And actually, with weak cervixes, sometimes holding it and working up the leg to kind of draw energy up can actually help strengthen a weak cervix.
Oh, wow. Okay.
Yeah. So
Cool.
that's one of the main points. But also, often people then are wary of working around the whole ankle because it's also connecting to our kidneys. And we know that the kidneys obviously are very connected to the reproductive organs. So people think, oh, I better not work this kidney point, this bladder point around the ankle. But as long as you're tuning in, then so those are the main points around the ankle. And then there's some points around the shoulders, especially the top of the trapezius. It's a gallbladder point, also related to an extraordinary vessel. As you said, I'm going to talk. Well, what are the extraordinary vessels? Very short snippet. The 12 meridians don't have a meridian that connects directly to our reproductive organs. And they don't have a meridian that connects directly to our brain. Well, that connection's pretty fundamental in pregnancy, isn't it? For lots of different reasons. So we want to access it directly. So a lot of these so-called forbidden points are on these vessels that do directly connect with our brain and our reproductive organs. And so this point on the shoulders, it's gallbladder 21 on the top of the trapezius. Again, if you massage that area, you're not going to have that effect if you just massage your trapezius. But if you put your fingers in the top of the trapezius, say your middle finger, and really push down perpendicularly down straight down to your pelvic floor, you possibly feel a downward movement. But it does depend, as I said, each person responds differently to the point. You may feel a downward movement. Now, that's one I would tend to avoid with someone who had weakness in the cervix because you
Yes.
don't want to put more downward movement in the body. But if you do that, it's hard to do on yourself. If you hold that point, but also a point at the wrist, it actually changes the whole emphasis rather than the energy moving down, it moves out along the arm. So you can release the shoulders. So even that, sometimes someone that's got a weak cervix, I might still massage the trapezius. I might even hold the point, but connecting with the hand so that it sends it somewhere else. So it's also, I think acupuncturists probably have to be a little bit more careful with the points because they're tending to just work 2 or 3 points. But as a body worker, we can connect it with another part of our body. So if we know this point has a strong descending effect, and then we evaluate our client and feel, well, does she really need strong downward energy or not? That's why, obviously, later on in pregnancy, just before birth or preparing for birth, it can be a good point to help the baby
Ah,
engage. But if
yes.
you're trying to encourage a breech baby to move, you might not want the bottom to engage more. So do you see what I mean? If you
Yeah.
understand a bit what's the nature of each of the point, you can then decide if it's a good idea to use the point or not. So that's one. And I know that I have come across body workers who are afraid of working the trapezius because they're worried that they might do something, dangerous. But no, you have to, it's a very different feeling if you massage it than if you really give deep downward pressure. So
Yeah.
it's also how you work the point, not
Right.
just the point is. Yeah.
I love you talking about incompetent cervixes.
Mm.
Um,
I
and
don't like that term, by the way. That's
oh,
why.
you don't tell me more about that.
Oh, just because it's like an obstetric medical thing, like saying your body's incompetent. I I just say a weak cervix. It just needs a bit of support. I think the language that we use is quite important. So I try and avoid words like incompetent because it's like Yeah.
Well, I absolutely abhor the geriatric pregnancy term. I'm like,
Yeah.
oh my goodness,
Oh,
what
yes, that's dreadful.
you
Yeah.
right? What a way to make a woman feel awful about her
Yeah.
pregnancy.
Yeah, exactly.
Oh,
We
yeah,
need to really
I love
change all
that.
these.
Yeah,
That's why I don't like to say forbidden points, but transforming points, because it's like, well, we want to look at the potential. And yes, we need to be aware of certain situations where we need to be a bit more careful. They're powerful points. So I'd say if you're going to use them, find out a bit about them.
yeah,
I've told you the essence of those 2 points, a downward action and stimulating the ankle.
I love that.
But yeah, that's the only one really with the downward action that you need to think.
Cool.
Yeah,
Well, I absolutely loved and adored your summit interview this year. I learned a lot, and I know you share three amazing techniques that we can do with all of our pregnant clients, whether you're a doula or a body worker, right? Or that, yeah. So please, everybody, listen in to the summit this year so that Suzanne can share more of her amazing knowledge with you, because I found it absolutely fascinating learning more about these points. So, Suzanne, thank you so much for sharing your wisdom with us today and helping us to understand how to listen to the body and that there are no particular forbidden points. It's
yes,
that we need to be listening to the body and really assessing whether what we're doing is feeling right or not for the person we're working
yeah,
with. That's the
yeah,
biggest takeaway I'm taking from this summit or from this.
yeah. That's really important. Yeah,
uh,
and to not work with fear, but to work with the potential of transformation and support. That
yes.
we're supporting a woman and we're offering her a really amazing opportunity to connect with herself and her body. And I think it's important to do it. One of the techniques I show it in a way that the woman herself decides how to
Yes.
pressure and to really empower women. Because if we're saying, oh, there's these forbidden points, then women themselves might start to be worried. Oh, maybe I shouldn't have massaged my ankle, or maybe I touched this point and something happened. And we don't want them to feel guilty or blame themselves. For me, the bottom line is to help them feel more in tune with their body.
Amen.
Yeah,
Amen. So important, Suzanne. Oh my gosh, you and I, we're definitely on the same page as far as
yeah,
approach and the way that we engage with our clients. I just so appreciate that with
yeah,
you. So thank
yeah.
you.
It's lovely to talk with someone who is on the same page as well. Yeah,
Yes.
yeah,
Yeah. Thank you. Oh my goodness. We'll have to
yeah,
see about having you on here again at another time after the summit, everybody. So please join us for the summit this year. Put it on your calendar. The doors will open end of March. And Suzanne's, you've got to, check out her gift for you. So important to know more about these points and how we can better support our pregnant clients.
mm,
So helpful. It really opened up my eyes. So I'm excited to share that all with you. And thank you for this conversation today, Suzanne. Hopefully, people have a better understanding of how to listen into the body and
yeah,
understand that there really is nothing that we can do to cause a miscarriage
mm,
or cause someone to go into labor. It
yeah,
truly is the whole body making that happen. And there's nothing we can do specifically to encourage
yeah.
that.
We can support the whole process, but
Yes.
we're supporting the body to do what the body needs to do. Yeah.
Yeah. Awesome. Amen. All right. Well, thank
Yeah,
you everybody
thank
for
you.
listening in. And we will see you all on the next podcast. Take care, you guys. Bye bye.
Bye.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code podcast50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.